for some discounts. I've got two types of memberships for you. I take a debit or credit card for payment today. Hey, I guess I'm on Facebook Live. Cool. And so the two offers are on our club membership. It's normally $50 a year. Today you can get it for $25. Next year for the renewal, it will go back to $50. Now these are for first-time members, and then next year your membership goes back to normal price. Now that gets you in at 10 a.m. 7 days a week. You get two membership cards with it, and you get it for a whole year. Okay. But if you'd like something extra, that's our Plus membership. You get free shipping with a $50 minimum purchase, so you don't even have to come up to Fort Smith. You just get online, use our app. You got a couple of choices. Order your non-perishable dry goods, your paper goods, your cleaning goods, your pet supplies. They'll ship right out to you for free. So it saves you some time and money. You're going to get early shopping hours with this membership. Come in and beat the crowds. 8 a.m. shopping for Plus members. You're going to get Sam's Cash. So when you're shopping us in person, you get money back for those purchases. And we pay it back to you every month. You can do whatever you want with it. You can use it when it's offered. You can save them. You can even come in the club and cash them out and go spend them somewhere else. So it's money that's going to help you make a little bit better savings, okay? You get free car washes from us too up in Fort Smith. Everybody enjoys going through the free car wash. Save $7 every time you do that. So we've got lots of benefits for that Plus membership to help your life be a little bit easier, and you get the second membership. So if you've got a family member you want to share that second membership with, you can do that too. So that membership's normally $110 for the year. It's $60 today. So you're going to save $50 by trying it out. And then next year, if it didn't work for you, you can drop down to the base for $50, or you can cancel the whole thing. It's up to you. So if you're interested, I'm here. I'll be here way after the meeting. So if you want to sign up, or if you have questions about your current membership, if you'd like to upgrade to the Plus, I've got offers for you on that one too. So come back and see me. And anybody have any questions? No? All right. And for the Senior Care Alliance group that's here, if you like what I offer and you have an office and you want me to offer it to your employees that are not members yet, we visit companies just like we do here, and there is no cost for you to have us come visit. If you're from Rogers and you're interested, I've got contacts up there that I can put you in contact with. Okay? All right. Thanks for your time. All right.
Hey guys, my name is Jessica. I am the admissions coordinator for the Blossoms. We are a skilled nursing and long-term care facility. So we do short-term rehab stays if you've been in the hospital recently due to falls, weakness, and infection, and you're just needing a little bit of therapy to get your strength back, get back on your feet, and get back home. We can do that. We do take most managed Medicare plans, most major insurances. Our Van Buren facility is VA contracted for that. We can work with your benefits to get you some rehab and get you back home. And then if you do reach the point where you are needing that 24-hour care, then we have long-term care services available as well. We have multiple facilities in Arkansas. Locally, we have a facility in Van Buren and in Fort Smith. My phone number to reach me is 479-650-3203.
Hello, my name is Adriana. I'm working for River Valley Primary Care Services. You know, our clinic here in town is Lavaca Wellness Center. It's based in the school, a block from here, that way, sorry, I'm confused, that way. And we accept all insurances, and we open Monday to Friday and 8 to 4:30. We have also our dental clinic here in the same location. And soon, I don't know if you heard, but probably they're going to start building a new building for the clinic and the dental crossing the street. But for now, we're going to be in Lavaca school until they complete that project. Probably will go start next year. And you don't have a PCP, we're here for you guys in this town. And if you already have a PCP, but you're sick, you can call us to see if we have openings, and we can see you too. But the only thing it is, because it's by appointment, it will take a little longer for them to see you. But we'll accept also walk-ins if we have actually appointments available the same day. And you'll see me here in all the events, so that you will see me again soon in the next event. Thank you.
Go ahead.
Hi, my name is Amy. I'm with a company called Advanced Wound Therapy. We are a mobile wound company, so that means that we can come directly to you, whether it's at home, a facility. We have a nurse practitioner, a medical director, RN, paramedics that works with us, a great team. Just to tell you a little bit about our company, so we're founded by a former ER physician. He was actually worked in the ER at St. Francis in Tulsa. He headed up the pediatric board. And after COVID, he decided he was taking a break away from healthcare. He felt burnout like a lot of healthcare workers, I believe, did. And he stepped away, and he just felt this calling, and he saw a need, especially in these rural areas where it's difficult to get to some of those services that you need, and wound care being one of them. We find a lot of times that the patients who have the most difficulty getting to their appointments are the ones that need it the worst. So we try to make it easy. We come to you guys. You can kind of think of us as a mobile wound care center, just like a wound care center, but we come to you. So we order supplies. We work with home health companies, and just make sure you have everything that you need and get your wounds healed. So I have my cards. I can leave my information if anybody needs it. I'm happy to hand it out. So thank you.
Well, good morning, everyone. I'm Lance Glenn. I'm a funeral director with River Glen Cremation and Funeral Services, also Lewis Funeral Chapel. We are a full funeral provider. We provide prearranged services for anyone that wants to prearrange their services. We provide any funeral services for individuals to go anywhere in the state of Arkansas, anywhere in the state of Oklahoma, and then of course, if you're wanting to go out of state, we would take care of those preparations and everything for you also. We also provide any sort of information about prearrangements. If you have a prearrangement with someone else, with another funeral home or anything, you have questions about it, we would love to sit down with you and just discuss those. We're not trying to win over your business, not trying to get you to change over to a different funeral home. We just want to explain what you have. That way you know exactly what's taken care of, and just eliminate all of those questions about if I do have everything taken care of, if there's going to be something that's going to come up later. We want to answer those for you and make sure you know the answers. Okay, our card is in those bags. It's River Glen Cremation and Funeral Services. So you can contact us. Our number is 479-551-0981. And if you have any questions, we'll be right over here at the table also. So thank you guys.
Hey, we stole the sign-in sheet, so. I'm Sarah Floyd. Most of y'all know me. I'm from Lavaca. This is all my family sitting over here. So, I work with Home Instead, and so we do in-home care. So we can come out and help with cooking, cleaning, laundry, bed changes, total care, or just take you to doctor's appointments. So we go from one extreme to another. We do have a new program called the Cincy. And so once you sign up with us, it looks like a little air freshener. You can plug it into the wall, and it has a router with it. We bring it into your home, and it alerts us if you have any calls or if you're hollering for help or there's an emergency. It'll give us gastrointestinal alerts if you're saying my stomach hurts or I don't feel good or I don't know which medicine I should take. That it just has keywords and phrases that it uses to trigger it to let us know that there might be some confusion or you might need some help. And so that's something new that we just started putting into homes. There's no charge for them. So we can come in, put it in your home once you sign up with us, and if there's a need, especially for people who live alone, it's good as another, kind of something there. It's not a life alert, so it's not something you can push. It's just voice activated with those keywords and phrases. So, if you have it in your home, you holler for help, then it alerts us and we can call and check on you. So kind of an example of something that happened is we had a lady that we were taking care of during the day. And that's when her family thought she needed it. That's when we thought she needed it. And so we were going out every day taking care of her during the day. Well, we would get there in the morning and she would be upset and act like she hadn't slept. And we were like, what's going on? So we put this in her home and it was alerting us that she was falling at 3 o'clock every morning. And she was getting herself up, but it was taking a lot of the morning, from 3 o'clock on. She was trying to get up, get back to her bed, things like that. We wouldn't have known that if we didn't have that in there. So we made it where we're now taking care of her overnight, and it took care of the problem. So we can still give her dinner at night. We can be there throughout the night to help her up, to get her right back to bed, make sure she has breakfast in the morning before we leave. And it really helped us see that those are really affecting when the people need the help. And so it has been great for us to kind of be able to use those to kind of see if we're helping people in the right capacity and at the right time. So any questions on that?
Do you have to be utilizing other services to get that?
You do have to have at least one shift a week. So that's just 1 3-hour shift a week that you have to have in order to get that in your home.
And you bill it to insurance or is it private pay?
We do VA, Medicaid, and long-term care. A lot of ours is private pay. A lot of people will do that appointment around, or do those schedules around when they need to go to the grocery store, or when they have a doctor's appointment, or if they just want the house, some light housekeeping done, things like that. So. Calling her out, huh? Any other questions on it? It's been really neat to see how much it's alerted and helped people, because it's just another security for you. I was kind of fearful about it at first, introducing it to people, but now all my clients love it. They ask for it, and if I take it out, they're like, we want it back. What it is we put a plug in every room that you're mainly in, so in your bedroom and in the kitchen or living room. And it's just a little box. We plug it in, and then you can even charge your phone on it still, so it's not taking up that plug if you charge your phone there. And you don't even notice it's there, And it just alerts, and we'll just call you and be like, hey, we just want to call and make sure that you're okay. And you can be like, I need help, or, I'm fine. Thanks for calling, So.
How do you find out about, costs? You just call and
Yep, just call the office, or you can catch me before we leave here. And what we do is set up a consultation, so we can just come out to your house, do the consultation. And we have actually several people here in the community that we take care of. And everything's privacy, and so you don't have to worry about anybody else knowing unless they don't care, But we can help get any home health or hospice or any other agencies. We work with all these people. So if you decide to go to a facility, we can help you find one. If you decide, and we can go with you even if you want. We work with all the home health, so just anybody in town. We help with doctor's appointments, so anything that you need help with, we can help get you plugged in with our community of people that we work with. Any other questions? No? All right. Thank you.
Good morning. I've talked to a few of y'all this morning already, but I'm from Van Buren Legacy Heights in Memory Lane in Van Buren. We are independent living, all-inclusive. We cook 3 meals a day, 7 days a week. We do your laundry and your housekeeping Monday, Wednesday, and Friday. We have activities in the morning. We have activities in the afternoon.
We also have, it's independent. It's like renting an apartment in a family community in a hotel atmosphere, and you come and go as you please. We do have 24-hour security, and we're just like a family. We all look out for each other, and you never have to be alone. You can be alone when you want and be with the other residents when you want, and be able to eat with someone all the time and not have to eat alone. And you don't have to maintain your home, worry about who's going to mow the grass, who's going to take care of the air conditioner or the heater. So if you know of anybody, or if you are tired of maintaining your home, we would love to show you around our facility. And then also we have Memory Lane Assisted Living, and it is for the need of memory of dementia or Alzheimer's. And it is assisted living, which is 24-hour nurse care, 24-hour CNA care. And so if you know of anybody in need of those services or a loved one, then we can help them out on that too. So we have different apartment sizes: studio, 1 bedroom, large 1 bedroom, 2 bedroom apartments. So we have a variety. Our number is 479-262-6466. Thank y'all. We're going to have door prizes now also. So, where's we? Thank you. Okay, who, how do I do that? The name. Yeah. Yeah. Let's see. Oh, somebody want to pick a number?
6.
6. Okay, Cheryl Corbell? Corbell.
Cheryl Corbell.
Okay, somebody pick another number. 25. Chronister, Lavelle. All right. Somebody want to pick another number?
13.
13, that's a good one.
Chuck Gardner.
No cookies, okay.
I just know him from.
Okay, another number. 17, GM.
Gary McLaughlin.
Okay.
Do you want cookies, Gary? He's not gonna pay attention. What was the next number?
What's the next number? 10.
Gloria Huck.
Is that you, Gloria?
I'm telling you, somebody should